Hello, my name is Madeline Silva, and this is my Netflix scenario for Kin 241. This is going to be our Maria. So in this scenario, Maria is getting up, going back and forth, refilling her water bottle. We see she keeps rubbing her jaw as if it was hurting her, opening her mouth to relieve some of that tension. She's looking pale, and she complains that her hands are clammy. So what we first want to do is advise Maria to seek medical attention. So Maria refuses, explaining that she's okay, but we want to ensure to her that although she may feel okay now, it could progressively get worse. So we could offer to drive her to the hospital, call 911. She keeps insisting that she's okay, so we can take preventative measures by taking off like any restrictive clothing that might make her feel even hotter, giving her any medication such as Tylenol or Advil to help her feel better. And then once Maria passes out, what we first want to do is make sure that she's landed in a safe position, make sure that there's no objects around her that could hurt her while she's unconscious. Next, we want to talk to the daughter. Seeing as she's currently unconscious, she can't give medical consent. So we want to talk to the daughter, get that consent before we do anything. And we want to tell the daughter to call 911 to seek more professional medical help while we do what we can here. While the daughter is doing that, we want to go ahead and put our protective gear on. So this could include something like gloves if you have them on hand. Next, what we want to do is check Maria's pulse. She doesn't seem to have a pulse. We open up her airway to look for any blockage, look for signs of breathing. She currently doesn't seem to be breathing. So keeping in mind the symptoms Maria had before she passed out, this gives us the idea that this could be a cardiovascular issue such as a heart attack. So what we want to do is, if we have a CPR mask on hand, go ahead and use that. If not, we'll just do without. We want to go ahead and start compressions. We'll do CPR. If we have an AED, we would use that, but most households don't carry AED, so we will continue with compressions until further more advanced medical help arrives.